Informed consent is a whole process. It's not just a form. Hi, I'm Dr. Maelisa McCaffrey, author of the upcoming book, Stress-Free Documentation for Mental Health Clinicians. And in this video, we're going to do something a little different. Because of my upcoming book, I am also revamping all of the courses I have. So there are 2 online courses you can purchase right now, and I want to give you a little taste of that before we revamp them. So you can check out Documentation Made Easy, which is about to become Stress-Free Documentation for Mental Health Clinicians. And this is a lesson that is inside that course that I will be updating, but keeping a lot of the same components. So we'll be talking about informed consent and all of the other processes and how they relate to paperwork that you have clients fill out in the intake process. So check it out.
Welcome to your first lesson for assessment and intake. So in this lesson, we are going to talk about reviewing paperwork and what needs to be in your informed consent and other documents. So first off, I want you to think about what you want to get out of this lesson, and think about beforehand what stresses you out about intake paperwork and what are questions that you might have about informed consent, whether that's the process or the form itself. So any of those questions you want answered, write those down so that you can be thinking about them as you hear different suggestions. All right, so first let's talk about your policies and your forms. So you want your policies obviously to take into consideration your ethical guidelines, your state requirements and law, and also your client and population specific needs. So you're considering the things you need to have in there, but then also what are the things that can make your paperwork and your policies more relevant to the clients you see. So for one example, I heard a podcast where a therapist was talking about working with a lot of clients who have chronic pain, and that she created a lot of policies specifically around that because she found that it was more helpful to her clients. And they were policies that were not necessarily intuitive or things that she had before she had that specialty. Lastly, also consider your own schedule and preferences. So if you want to say that you are available from 1 p.m. to 9 p.m., you can do that. If you want to say you're available from 9 a.m. to 2 p.m., you can do that. But just make sure when you're creating your policies that it's very clear and you're thinking about those things ahead of time. Now, your forms serve as the written proof that you actually reviewed those policies with your clients. So really that's what your forms are doing. They are just a way to help your clients see what those policies are. They help to remind your clients after time has passed. So for example, when clients come to see you, they have a lot going on. They've typically waited a while before they've come to therapy. And even if you did a great job reviewing policies and they have a copy of your forms and everything, they may not remember your cancellation policy, right? They might have to go and reference it. So it's a place for your clients to be able to do that. And most importantly, your forms really do not have to be scary or complicated. They don't have to sound like legalese. They can sound easy to understand and should be that way. Now, here's a tip I would recommend if you have your intake paperwork already, or even if you purchased my paperwork packet, have that with you while you're watching the rest of this training so you can kind of go through and check off the things to make sure you have all of these sections in your different forms. So for your informed consent, now you can have this be one page, you can have this be multiple pages, but regardless of how long it is or detailed it is, your informed consent document needs to have informed consent information. It needs to have limits to confidentiality. It needs to have fees and your session structure. So that means if you have a sliding scale, that fee should be on that document that client signs. And at the top, when I say informed consent information, that means like the benefits and drawbacks of treatment and the fact that your client is consenting to therapy and that they understand there are no guarantees with therapy. You also want to have your late or no-show policy. So think about things that can often cause conflict, which would be confidentiality and payment usually are the big things that cause conflict, potentially when it comes to your policies. So make sure that you have these up front. Some other policies that can be really important would be if you have limits of confidentiality specific to a certain population. So if you work with court-mandated people, for example, or something like that. Sharing of information among other healthcare professionals. So if you tend to work with clients who often have a psychiatrist and you find it helpful to consult with them, or if you work with a lot of pediatricians or something like that, then go ahead and put in your informed consent that you often consult with other professionals. And in my document that I sell, I have a statement about the fact that I may often consult with other professionals, but any time that there is something important, or if I were ever going to somehow divulge information that would reveal the client's identity, then I would get their permission beforehand. Also think about your use of email or texting. So both of these things are really commonplace now, much more the norm for therapists to interact with clients this way, but you want to have in your policies how you do that. The big thing that comes up here is clients' expectations of when you're going to answer. So you don't want clients texting you expecting that you're going to reply right away. So if you have something in there about, you only reply during business hours and then have your hours listed, that makes that totally acceptable. Now, I want to really highlight here one thing that a lot of people miss, and that is when we're talking about limits to confidentiality, a lot of people don't realize that even out-of-network insurance can impact confidentiality. So I absolutely recommend you have this in your informed consent document, even if you are private pay, because anyone who requests a super bill needs to consider that their insurance company could potentially request their records. And if that is refused, their insurance company can choose not to pay for their therapy anymore. So that is something a lot of clients don't know, and it's really important that you let them know that. Now, when you see clients the first time, you want to make sure you document the fact that you got that consent for treatment, even though you have this form that's already signed. You always want to document these things, and I recommend check out the intake note template to see an example of this. And this is one of the few circumstances where you can really copy and paste this information every time you do an intake assessment. So you always want to document that you reviewed policies and procedures, you explain the limits to confidentiality, and you reviewed potential benefits and drawbacks to treatment. And then you also specifically want to state that you obtained consent for treatment. And if this is a child, you can say that you obtained assent from the client and that the parent or guardian provided consent. But these are all things that every client that you see, every new client you see, all four of these things should be in that first note. And that is to protect you. Now, some other forms that you want to consider for your practice are a notice of privacy practices, and there is a link to this form. This form, I don't think you need to get from any person because the federal government has already created it for you and they did it and they offer it for free. So why change it if they've already given you their approved version? The only thing that I did in the link that you'll see for this form is I did tweak it so that it's specific to mental health. So the one that the federal government provides is for general healthcare professions, and it has things like about coroners and about donating organs during death. And so those are the type of things that I took out to modify it so that it's specific to mental health. Some other forms you want to consider, and these are things you could either just put in that informed consent document. That's how I do that for my paperwork packet. It's a longer consent form. It's 6 or 7 pages, and it has all of these policies listed. Some people prefer to have these listed as separate forms and have clients sign separate forms. So it's totally a matter of preference. But a social media policy, so regarding how you interact with people on social media, and if you interact on social media at all, and the fact that you don't expect clients to follow you, and the fact that you do not reply to them, and the fact that you, that is not a form of treatment. Those are the big things to have in that policy. an authorization to release information. So again, this might not apply to all of your clients, but anytime you release info, you need to have one of these forms completed. And so you absolutely need to have this form ready. Now, one thing I encourage you to consider when you're thinking about all of your policies, again, I said at the beginning that these don't have to be, formal and scary. They can be personalized. So think about the fact that, clients need to understand your worldview. And a lot of times when you're reviewing paperwork with people, it's the first time they're meeting you. So you are making an impression with these documents. So if you can personalize them a little more and show clients the types of things that you are open to discussing with them, it will really help start things on the right foot. So show them that you understand with your forms and bring up topics that you're willing to talk about so that they understand that you're willing to go there. I found this one interesting article about clients and religion, and this quote was just really fascinating. It said, "The number of religiously oriented clients is far greater than the number of secularly oriented therapists. For this reason, it's a good career move for counselors to increase their cultural competency by including some training in Christian counseling, or to network and develop a referral source with a local Christian counselor." And so this is more in reference to the fact that you need to consider the fact that a lot of clients are religiously oriented. And so if you are not, then be open to that and still have things about that in your forms so that clients know, people who are religious, people who are spiritual, that is a very personal and important part for them. And they need to know that they can talk about that with you in therapy. And an easy way to do that is to simply have a question about that on your form somewhere. And then it opens up the conversation and people understand. So, and then some common cultural considerations are all listed here. There are a lot, but these are all different things you want to think about when you are creating your forms and the language that you're using. Don't be afraid to use the language that is meaningful to you because it is likely also more meaningful to your clients. What is your biggest takeaway? Think about what was one of the biggest things that you an aha maybe you got from this lesson, and what is the next action that you feel you need to take? So things that I recommend would be download the paperwork checklist, and then consider some of the cultural aspects that maybe are missing in your form, or even some of the personal aspects that are missing there. And then identify how you can adjust or revise your current forms. And maybe you need some additional forms. So maybe there were some things that you saw here that you don't have in your paperwork packet yet. So identify those things and then, schedule a time to adjust and revise your current forms. It doesn't have to be right now, but if you put it in your calendar, it'll be more likely to happen.
Thanks so much for watching. Go ahead and leave a comment below and let us know what you thought about it. You can also click in the description. You'll have to click on that box to open up the description underneath this YouTube video. And then you'll be able to see how you can sign up for both Stress-Free Documentation, the course, and Stress-Free Documentation, the book. Happy writing!